medical heritage of ancient India, the third great area. First of all, we can ask, do we have material remains that show evidence that medicine was practiced in India? And this is one big example over here. We have seen that way back 9,000 years before in Mehrgarh, people were using a dentist drill. You can see this tooth over here that shows evidence of drilling with a flint head and healing. It is also very effective at removing rotting dental tissue, and clearly this man who had had a toothache has survived after this particular procedure. This is showing that even 9,000 years ago, we were making use of medical things of this nature. Then we also have evidence in Harappa and Mehrgarh that people are practicing trepanation. Trepanation is a process where you drill a hole in the skull, and nobody has a clue why people were doing this. And today we suspect it could be because people were eating pork in those days, and pork contains tapeworm parasites, and in its life cycle it also involves a brain. So maybe they were either relieving pressure in the brain by removing extra fluid, or maybe removing some of the parasites by hand. But clearly we know that some of the skulls show signs of healing. So whoever underwent this cranial surgery has survived this surgery. That's what we know. Then we have the famous prosthetic eye about 5,000 years ago near Balochistan. This is near Burnt City in Iran, very close to Balochistan, that practiced Indus Valley kind of things. And this one shows this particular skeleton has got a bitumen eye in it, clearly showing prosthetics made use of in a very early period of time. What is interesting to us is in this grave were found several cultural artifacts that shows that it is similar to what is there in Harappa. For example, measurement ruler, dice, bowl showing an animated story, and these kind of things are found even in Harappa, showing that there is a similar culture here and there. Then very famously, we have the colonial documentation of rhinoplasty, that Indians are practicing a kind of plastic surgery where people did not have nose. For example, they would take the subject and cut in his forehead a flap of skin, but leave the skin intact at the base of the nose. That would be twisted and allowed to fall down and fashion into a new nose for the person, and the blood supply would contain, because we are not cut off at the base of the nose. This would form a new nose for the person, and this part of the forehead would heal. This was recorded by the Britishers in 1794, showing how Indians are doing Sushruta surgical techniques for plastic surgery of this kind. So with this background, we can talk about origins of Indian medicine itself. Indian medicine has the roots in Atharva Veda. Atharva Veda gave rise to Ayurveda, which is the science of life. So disease and ill health was seen because of two reasons. One is because of unwholesome diet that gives you some problems, and that requires Atharva Ayurveda to cure. On the other side, it also saw you can have ill health because of karma phala and some transgressions that you've done. And to cure that, you need prayaschita and some mantras of Atharva Veda to cure. So two ways of looking at this. One way is Indians were aware of disease that can come because of poor diet, physical reasons. They were also aware that disease can be there because of the mind, mental issues, and mental issues require some kind of psychological healing, which is prayaschita. Two ways of looking at it. So we know that in India, the goal has always been to know Brahman through yoga. For example, this Patanjali's Ashtanga Yoga, where you have asanas, pranayama, yamas, niyama, pratyahara, dharana, dhyana, samadhi. And the whole idea was you slowly ramp up so that you're in a position to yoke with the Brahman. That is the idea. However, we know if you don't have a healthy body, there is no way you can go through this. At some point, you'll have a headache or a earache or a leg ache or whatever, and you cannot really do yoga meditation. So Indians expended great effort to even cure the body of any kind of problems so that you are in a position to for mind-body in balance. So with the idea of mind-body in balance, these ideas came about where we have the Tridosha system, Vata, Pitta, Kapha, and along with the Panchamabhutas, ether, air, fire, water, and earth, and interaction with the environment, hot, cold, light, transformation, cohesion, and so on. And people would, they were representing Vata is air plus space, Pitta is fire plus water, Kapha is water plus earth. And they also had, for example, symbolism. Your fingers were the Panchamabhuta, fire, air, space, earth, water. So a very well developed set of ideas were evolved in India to understand the human condition, medical condition, in terms of the Tridosha system. So here we can see Vata derives from the elements of space and air, translating as wind or that moves things, is the force that governs all biological activity. Pitta is the fire and water, that which cooks for digestion, metabolism, things that cater to organic acids and bile and other such things. And Kapha was elements of earth and water, that which sticks or lubrication, giving the smooth functioning of body parts. So this is how these Tridosha system was seen. And mudras, for example, we use them to stimulate chakras or energy centers in the body. Like I showed earlier, even the 5 fingers were associated with different panchamabhutas, right? So even when we hold a mudra for some time and go in dhyana, you're stimulating the pituitary gland and trying to get some beneficial hormones. This has been woven into our dance forms also, which are distillations of Vedic literature, things like Chandrakala, things like Garuda, Patakam, Ardha Patakam, Kartari Mukham. All of these are different gestures that the Bharatanatyam dancer uses, and it stimulates chakras or energy centers in the body. So the basics of Ayurveda, universe is composed of Panchamabhuta, air, all of these things, and through the Tridosha system controls the physiological functions. Human body is composed of Sapta Dhatus, the tissues, Rasa, Meda, Rakta, Asti, Vaja, and Mamsa, or Shukra. 3 malas with the waste products, and the Vata dosha maintains cellular functions, electrolyte balance. Pitta dosha maintains body temperature, nerve coordination, hunger, and all these things. Kapha dosha increases with sweet, fatty foods, lubrication for functioning. So Indians tried to see even the body parts, how are they related to the Panchamabhutas, and how do the Tridosha system control your physiological functions. And much deeper understanding was also there at the tissue level, understanding digestion, for example. They call them the Agnis. So digestion was a process by which various elements of the Panchamabhuta could be taken and given to the various tissues in order to be absorbed by the body. So clear understanding was there of digestion process, the need for energy, how the foods that we eat are being used, how the waste products are being created. All this understanding is clear in the understanding of Ayurveda itself. Sushruta is one of our greats, the father of surgery. So he wrote this work, Sushruta Samhita, 120 chapters in 5 sections, and 66 what people say are later chapters, discussing many things like gynecology, geriatrics, physiology, pathology, pharmacology. He's describing 1120 diseases in his work. He's discussing the human anatomy with 300 bones, 500 muscles, 300 veins, discussing many surgical methods, excision, incision, scraping, puncturing, bloodletting, rhinoplasty, surgery, cataract surgery. He describes 121 surgical instruments. So clearly one of our great physicians of the past, Sushruta, and his work is a literal compendium of medical knowledge. And here is the way these things are transmitted over time through palm leaves with illustrations. This is how Sushruta Samhita was transmitted over the times. And this shows the various surgical instruments discussed by Sushruta. You can see discussed in this particular book. And I will not go into details, but if you take a look at the chapters, you find various topics that he's talking about in, for example, qualification of a physician, training for surgery, surgical instruments, appliances, how do you use them, and things of this nature, going on to various excretory disorders, ear piercing, swelling, ulcers, nursing, food regimen for patients' recovery, injuries, 8 forms of injuries, progress in treating ulcer, prognosis from sense organs. So we are seeing that great amounts of knowledge are there in Sushruta Samhita. Additionally, Sushruta Samhita talks about using a cadaver. Just like today's medical students make use of dissection to understand the human body, he's talking about a kind of dissection. He's saying you take a dead body and you cover it with kusa grass and you keep it at the edge of the water of a rivulet. After 3 days, take it out carefully and gradually take off the layers of epidermis by gently rubbing with a soft brush. This way, the smallest and thinnest arteries, which are swelled by now, are visible, and you will understand about the physiology. And Alan Webb is a colonial historian. He is talking about Indian medicine. He's saying India was in advance of Europe with respect to practical medicine. Anatomy was not taught by dissection till 1315. The Arab Muslims were strictly fettered by the religious creed and absolutely prohibited from practical study of anatomy. So clearly it is the Indians who had deep knowledge next to Egyptians of surgery, of techniques and these kind of things. Similarly, we have the other great Charaka Samhita. Charaka Samhita too contains 120 chapters and 8 sthanas, and a great many pieces of information is encoded in Charaka Samhita also. This shows you some of the surgical instruments that were recovered archaeologically from a site in Takshila dating to 600 BCE. This is now in a museum in Pakistan, in Takshila Museum, and take a look at these instruments. These are the kind of things that Sushruta himself has discussed in his book, and we have recovered this dated to 600 BCE. Very fascinating to see this. In Sushruta Samhita, he also says what kind of criteria should be used for medical students. Just like today, he's saying the internal character and the external build of a pupil is to be seen. He says the pupil must be honest, humble, temperate, generous, hardworking, not supposed to be enamored with women, engage in gambling or hunting. Memory and academic performance are given importance. And it says medical training was acquired over 7 years. Rote learning was an integral part of medical education. They were expected to memorize the classical text and their commentaries. Very interesting to see how they were compared to today's medical students, very similar kind of things. This is a paper that I wrote with Professor Jagat Narula of Mount Sinai in New York, Hospital Sinai, where we talked about heart in Indian medicine. And there are several things in Sushruta Samhita, Charaka Samhita that describes disorders of the heart, valve functioning, and disorders. Very deep information, in other words. We just summarize this in this particular paper. We can see on blood circulation itself. So much is known on blood circulation in Agnivesha's work in Charaka Samhita between 400 BC to 500 current era, describing the heart, 10 prominent blood vessels, and the basis of cardiovascular system. Similarly, going on to Bela Samhita, Sushruta Samhita, Vagbhatar's work, everywhere we are seeing better and better understandings of the heart, circulatory system, and so on, showing to you how advanced Indian medicine was in a very early period of time. We even have, like I shown earlier, trepanation. Sushruta, for example, is aware of neurosurgical methods. He is dwelling on surgical procedures involving the head, mainly dealing with warfare injuries, trepanation, excising, probing, puncturing, and evacuating collected fluids. And he's also got an advanced understanding of nervous system. He's saying that 10 upcoursing dhamanis, which are nerves, perform specific functions of the body like sound, touch, taste, sight, smell, inspiration, sighing, yawning, sneezing, and such things. The downcoursing dhamanis, they control things like vayu, urine, stool, semen, and other such things. We also have his description of cranial nerves that shows how meticulously he studied these things. He's saying 2 nerves lower down at the back of the ear. If you cut it, it produces deafness, clearly showing he's understood even the auditory nerves. Pair of nerves inside the nostrils, if you cut it, you lose your sense of smell. A pair of nerves below the end of the eyebrow, if you cut it, it causes blindness, optic nerve. So clearly, Sushruta is also aware of these nerves. He studied it in such great detail. He's also aware of these things. How knowledge of Indian knowledge systems can remove a distortion. Today, a very big distortion is India's Jati, Varna, Kulam, Gotra has been taken and converted into something called caste by the British. And further, they say we are a caste-ridden society and discriminatory and things of this nature. These are all distortions that were brought about by the British, happily upheld by Nehruvian socialism, Marxists, and so on. So we have to understand what is the basis of this, and I am claiming that if you have knowledge of Indian medical systems, we can remove this distortion. And let me explain how that is possible. So if you look at the European construction of caste, they took our classical Jati, Varna, Kulam, Gotra system and perverted it into this alien, immobile, hierarchical caste system. Such things have never existed in India. In India, the system has never been immobile, the system has never been hierarchical, but they made these things. All these accusations of oppression, discrimination, upper caste, lower caste, untouchable, they all come from the framework of caste system which the British introduced. The roots of this goes to Aryan invasion theory using linguistics with caste as a racial construct of the Aryans. They converted the notion of Arya into Aryan, a racial category, and introduced this caste. All spurious. There is no such thing as Aryan as a race. There is no such thing as caste. So how do we investigate these things? For 360-degree investigation, we need to have a top-down traditional view. What does the tradition say about this whole thing? Bottom-up subaltern view. What do the practitioners say about these things? People, especially people they say have claimed discrimination, what do they say? Historical view to bridge the top-down and bottom-up. They had to be bridged appropriately. So we'll take a look at all these three things. If you look at the top-down view, the Bhagavad Gita, for example, it says Varnas are determined by the gunas of a person. Very clearly it is saying it is not birth-based or any such thing. It is your gunas that determine what your Varna is. Then this civilization has got things like Mahavakyas in the Upanishads, things like Aham Brahmasmi, Tattvamasi, equivalent of all, Brahman, and so on. So this is the next big thing. So what we are seeing is the top-down model is an aspirational model. It is what the civilization aspires for. It is not as if they reached it, but it is what they aspire for. We also know rules of Acharam and Saucha that have facilitated Varna mobility. If one wanted to go from one Varna to the other, all you do is adopt the Saucha practices, the Acharam practices of that Varna, and eventually you'll be accepted over there. Now, in contrast to the top-down aspirational model, we have the bottom-up model. It is basically a conflict model. It's a model that looks at conflict only. Conflict model uses colonial received wisdom of immobile hierarchical caste. It refuses to acknowledge the mobility and philosophical base. Vedanta is gone, your Mahavakyas are gone, none of them matter. All they say is there is an immobile hierarchical caste. In practice, we know British ethnocide created poverty, this notion of caste, destroyed livelihoods, instituted many, many distortions. And today, Marxist, socialist, leftist nexus, they uphold the same conflict model with many, many works. This is where we are today. Now, if you look at the reality, how did British say we are a hierarchical society? Nothing in India says Brahmins are at the top and the Shudras are at the bottom. So where did this hierarchy come from? Well, if you look at history, you can take a look at this book, Shivasya Kulam, where he's saying Achara practices were used to create the hierarchy. In other words, if you read this over here, it says Max Weber and the others, they use Brahmins as a reference scale. In Madras census, for example, they said the initial factors to consider to determine the relative social status are the degree to which food and water touched by the various castes will be accepted by others, by the extent to which barbers, washermen will do service for them, by the length of period of pollution observed by them after birth and death, by their occupation, by wearing or not wearing sacred thread, by allowing or not infant marriage, widow remarriage, by the distance by which they are permitted to approach the innermost part of temples. So they took the acharam practices of various groups. They said Brahmins are the reference. If others had other acharam groups, they were placed in the hierarchy. They created a hierarchy based upon the practices that people had. Rather than it being encoded in Indian text, they looked at practices of people. These practices of people were used by them to create hierarchy. That is where this whole notion of upper caste, lower caste, all those things are born by the British. Such a thing is never there in the Indian context. So we should now take a look at the historic view for evidence of public health awareness in the ancient past. For this, I'd like to tell the story of Karkati. Karkati is a story that appears in Yoga Vashishta. Yoga Vashishta is a work where young Rama is being taught by Vashishta and Vishwamitra a series of stories, and that's encoded in this work. In this story, Karkati is a gigantic monster, consumes human with insatiable hunger, except those protected by mantras, medicinal herbs, austerities, good deeds. But this demon gets a boon from Brahma, becomes a pinhead-like entity through which it attacks people who consume uncooked food, ate untimely, gluttonous, lose morals, and dwelt in unhealthy places. This needle head-like entity entered through the nostrils and the ears and made it to the heart and disrupted other organs and attacked only people given to drinking and all these kind of problems. Anybody who sees this story in Yoga Vashishta will immediately say Indians have got a clear idea of germ theory. This is saying that diseases are caused by pinhead-like quantities entering the nose and eyes. So clearly our rishis have understood that pinhead-like quantity is causing these problems. It is showing ancient encoding of the importance of prudent diet, hygiene, good mental and physical health. We know that India has always been in a tropical country, always had monsoons. Whenever monsoon happens, we have waterborne diseases like cholera, dysentery, typhoid, all these malaria and such things. Our rishis must have seen every time the monsoons happen, India suffers many, many epidemics. And they would not have kept quiet. Just like recently we had the COVID epidemic when scientists are scrambling to find drugs. Just like that, when the rishis saw village after village, people are wiped out by epidemics every time monsoon comes, they must have thought about it. They must have thought about it and got the answers that it is because of pinhead-like entities. And the story is encoding hygiene using metaphors with memory of deadly illnesses, smallpox, cholera, malaria, and other such things. So clearly we are seeing in Yoga Vashishta, I'm not even going to the date of Yoga Vashishta, however old it is, Indians have an idea of disease transmission mechanisms over here. Then we look at the British accounts. In 1767, the British, this person Holwell wrote this work saying inoculation is performed in India by a tribe of Brahmins who come from distant provinces, divide themselves into small parties of 3 or 4 and plan their traveling in such a way as to arrive at the destination some weeks before usual return of the disease. In other words, he's saying before the monsoon comes, there are groups of Brahmins who have got the material and such things, and they're planning the travel circuits for inoculation and so on. And another paper in 1819 in Asiatic Journal, this paper in 1819 is saying inoculation is done for cowpox from old times is known to Hindu medical writers. It is referencing Dhanvantari. It says 9 types of smallpox are known, out of which 3 cannot be cured. And the author proceeds to say the rules for practice of inoculation to cure the curable parts of smallpox. And this paper continues to say, take the fluid on the pock of the udder of a cow or the arm between shoulder and elbow of a human subject. And once you get that blood, you mix it with this pox and you have created the fever of the smallpox. Then it says when you inoculate a person, he will have a fever for 2 or 3 days. And after that, he'll completely recover and there'll be no smallpox after that. Clearly showing Indians have practiced variolation, inoculation at a very early period of time. This is what the British are saying. Another paper in 1827 says in Odisha, there are people who are gathered on a Sunday or a Thursday and they will also be given inoculation. So we know that all over India, Brahmins were conducting inoculation. It is not as if they're going house to house and saying, hey, are you a Brahmin? I'll only give you inoculation. They were inoculating everybody in every part of the place. We know that the British banned Indian inoculation in 1865. So from 1865 onwards, this kind of inoculation has disappeared in the country because that knowledge is dead now. But earlier, our Vaidyas were doing this kind of activity all over India. This clearly showing medical practice. So what are our observations? Our observations are the British records are saying Brahmins conducted inoculation. This does not fit the conflict model. The conflict model is saying that the Brahmins were at the top, they practiced discrimination and such things. But if they are the ones conducting inoculation, it does not fit that. It says Brahmins, Dharampal said Brahmins taught students of all jatis in his work Beautiful Tree. You can see that. This also does not fit the conflict model. The Vedanta view of Varna with Aham Brahmasmi, Tattvamasi, these Mahavakyas, that also does not fit the conflict model. They've got many historic personalities like Valmiki, Vyasa, Aryabhatta, Saurashtra Brahmins, Peshwas. This also does not fit the conflict model that people are pushing on us. What we are seeing in practice, Acharam and Saucha practices are defining mobility. As an example, the Saurashtra Brahmins, they were from Saurashtra area where they were weavers, and they would come to Tamil Nadu in Chola times and do trading over there. Over a period of time, in Tamil Nadu, they accepted the Acharam and Saucha practices of the Brahmins, and eventually they were treated as Brahmins themselves. So clearly, weaver community means it's a Shudra kind of situation, but then they've elevated, I wouldn't say elevated, they've become Brahmins, put it that way. So there's no hierarchy of elevation up, down, and those kinds of things. So what we are seeing is, if you want to become a Brahmin, you simply adopt that Acharam, Saucha practices, and you become that. And we are seeing importance of public health in Sushruta Samhita itself. In Sushruta Samhita, there's a cause of epidemics, for example. He says sometimes a town or city is depopulated because of a demoness or some pollens of poisonous flowers or grasses are wafted by winds, invade a town or village, produces epidemic cough, asthma, or other fevers and things like that. And he says the best safeguard is not to take the water from that area, vegetables from that area when an epidemic breaks out. And he's saying you can also migrate to a healthy area or unaffected locality. So clearly, even in Sushruta Samhita, we have got understanding of public health. That is what you're seeing over here. And cultural practices. For example, there's something called Basoda. Basoda is a festival in northern India. It is the last day in winter when you can eat yesterday's food. Because from summer onwards, when the temperature is high, food will get spoiled very quickly. So they made it into a cultural practice also, saying that the festival marks the last day of the season when you can eat stale food. So this way we are seeing medical knowledge is encoded even into cultural practices in India. So what we are seeing is in medieval India, kings invited Brahmins to settle in their kingdoms with various grants of villages. For example, these are copper plates that were given to some Brahmins to settle in Chola kingdom. And we know that when Brahmins come to a place, they prescribe town planning with Vastu Shastra, with different communities aggregated in different areas. They'll say the weavers live here, potters live over here, and the Brahmins live here, Kshatriyas live here, temple is here. And immediately people say discrimination. So immediately people say that discrimination, that Brahmins are segregating society. But clearly we see that is not the case. Indians have had a clear understanding of public health. That is what I tried to show with the inoculations, the Karkati story, and many other examples I gave earlier. We understood that each occupation has got unique biohazards. For example, if you're a weaver, you're working in a small room every day breathing the cotton fibers and so on, that is bound to give some tuberculosis or pneumonia or other respiratory issues. You will get some immunity to it. Maybe your wife and kids will get immunity. Your community gets immunity, but others may not get that immunity. Similarly, if you're an iron or goldsmith, you're constantly breathing metal fumes and vapors and things like that. Again, may give rise to unique respiratory issues where you've got some immunity, but others don't. If you're a farmer, you're exposed to soil corona complexes and you get some immunity, but maybe others don't have that. If you're a butcher, you're exposed to E. coli all the time and other pathogens. Again, you have some immunity, others don't have that. So clearly, understanding occupational biohazards, Vastu Shastra is prescribed so that each community lives separately to avoid mixing so that they have joint immunity among themselves. So what are we saying? My model of public health is a far greater fit for the Indian social dynamics instead of oppression. We have seen classic Vastu-based town plannings separating the jatis reflects understanding of unique occupational biohazards that each community has and their separation for public health. Here we are seeing the person with the least immunity is the Brahmana. We are seeing the Brahmin wakes up early in the morning, he has a ritual bath and he's just doing Gayatri Japa from morning till evening, reading the Vedas and other such things. Not much physical activity, not much good nutrition. So this person has got the least amount of immunity in this community. Therefore, he's got the strictest Saucha practices. If a Brahmin comes in contact with somebody from this community, have one bath. If you come in contact with somebody with this community, have two baths. Immediately people say this is discrimination, but if you look at it in the light of public hygiene, it is clear that this is not discrimination, but this is an understanding of public health and hygiene that drove these practices. Any practice that we take that today they say is discrimination, we can see that it started from understanding immunity and so on. Some people say, what about the untouchables? Well, in every community, whether it is in Europe or in India, the people who work with night soil, the people who work with all the dead bodies and so on, they're exposed to all the pathogens of all the groups. So they have the maximum immunity compared to others, but others don't have immunity to them. Any group does not have immunity. So they were required to live far away from the village. It is not discrimination. However, it is an understanding. Today, everybody's got vaccination and other things, so these things don't make much sense. But in ancient India, medieval India, these were very real, very real. So that's why systems of this kind evolved so that there would be Saucha practices, Acharam practices to prevent many hazards and other such things. So what I'm saying is my model of public health as a driver of Saucha practices is a far better fit, evidence-based fit than the conflict model of oppression and discrimination that Marxists, leftists and missionaries say, which are derived from discredited racial theories. We can see this, for example, even in Al-Biruni. Al-Biruni says that Indians call these foreigners as malicha, impure, forbid having any connection with them, whether by marriage or relationship, sitting, eating, drinking with them. One way of looking at it is blind discrimination. Second way of looking at it is public health, that these foreigners have got some pathogens that we don't know about. So we don't want any contact with them. That is why they isolated themselves. So clearly they think they'll be polluted if they touch these foreigners. They consider as impure anything that touches the fire and water of a foreigner. And so no household can exist without these two elements. So even in things like that, we are seeing it is not discrimination, but health awareness. Then we are seeing in other places that talks about purity of descent, for example. They're saying that in Artha Shastra, it is talking about rules of Acharam and Saucha that facilitated Varna mobility. The sons of Brahmin and Kshatriya, born of a wife belonging to the immediate next Varna, are the same Varna as the father. That is a rule of the Artha Shastra talks about. Offspring of Brahmin father and Vaishya mother is a Brahmin. And somewhere else, it introduces the possibility for a Shudra to become a Brahmin in Manava Dharma Shastra. If an offspring of a Brahmin man from a Shudra woman were to bear children from a superior partner within 7 generations of the inferior superior are all writings of the Marxists over here, then it talks about how the Shudra attains a rank of a Brahmin and the Brahmin attains a rank of a Shudra, clearly showing there's no up-low, but we are moving across the spectrum over here with rules of Acharam and Saucha. Then one might wonder, why 7 generations? Why did our Indians think it takes 7 generations for you to completely go to a new Varna? And we are seeing that today in things like epigenetics. Epigenetics is saying transgenerational genetics represents a different mode of inheritance. It suggests that the transgenerational effects are frequent and powerful and lasting at least 4 or 5 generations. And scientific evidence supports 7 generations future thinking. Our toxic chemical exposures may harm our great-grandchildren. This report over here is talking about epigenetics and how it takes 7 generations to be removed out. So clearly our rishis have empirically got the 7 generations as a number by which you can get the new varna that you are working towards. All right, with that I've come to the end of the medical section in addition.